For the cars, we will start by irradiating 10 to 30% in the extremity that we will be moving and irradiating at 10% higher throughout the rest of the body to prevent compensations. To begin with the cervical, we will slowly flex the chin all the way down to the chest, turn your head all the way we can towards that way, side bend, and then extend back as far as we can, rotate over, side bend, and return back to the middle. We will show a few reps here as we go through the motions. If you have any pain at any area, try to avoid that area and not go into pain. Don't compensate by moving the shoulders or raising the shoulders on the other side. Try to keep the whole body nice and firm. The next we'll go over is the spine. Cross your arms, flex as shown here, rotate as far as we can to the left, making sure that our hips do not move, as this is a common compensation. Side bend as far as we can, once again without the hips moving, and start to extend back. Rotate over to the other side, then we'll side bend as well, once again watching the hips, and then come forward. All this motion should appear in the spine. Here's the side view that we will show. Keep the hips tight, flex as shown. We're going to rotate towards the side, staying in that flex position. Side bend. As you can see throughout this whole motion, the hips do not bend. As we extend, we'll try to segment through the spine, and we do not want the hips to shoot forward as shown there. Rotate over and come back to the start. Next, we will look at the scapula. For this, can either be done with the arm at the side or with the arm in a different position. We want you to keep your fingertips along this crease of your pants at all times as you rotate up, back, down, and forward. Here's as shown in the scapular position, so not straight forward and not out to the side, but same thing, we will elevate up, retract back, down, and forward. We'll go in these motions just as shown, and then you can also reverse the direction. Next, we'll be looking at the shoulder, which has some of the most common compensations. Raise the arm up as high as we can, hoping to get past the ear, as shown there. Make sure the arm is not bent, which is a common compensation, and then also rotating or shifting the trunk. Once you get to the ear and get to a block, you're going to start to rotate. Make sure the bicep is rotating internally and not just your wrist. Rotate there at the bicep, and then start as you go back. Make sure we're continuing that rotation. You want to make sure we're rotating as at the end your pinky will be pointed forward. Next, keep your pinky in that position. Extend back until you feel a block, and then start to rotate. Once again, don't rotate your trunk. The irradiation of that 10% extra should help keep your trunk in its normal position while only moving at the shoulder. Here is a side view. So we'll flex up, hoping to get all the way past the ear without arching in the low back as we show here. That is a common compensation as well, which does not depict all shoulder mobility. Continue rotating on the way down until we end with our pinky forward. Next, we'll be taking a look at the elbow. So we're going to be looking at supination and pronation of the elbow. Start with your hand pressed up against the elbow to make sure we're not having any compensations there. As we show here, we'll fully supinate. The elbow area does not move. Flex up, fully pronate, and then back down. If you notice, the face of my elbow stays pointed forward the whole time, where if you see movement coming from the shoulder, it'll look more like that. So you always want the elbow staying in position as you rotate. You can do the same thing and flip the direction as well. So you are pronating on the way up and supinating on the way down. When looking at the wrist, it is good to block it so you're not moving the actual forearm, but only the wrist. We'll go in, down as far as we can, to the side, and then back up. You want to make sure you keep your fingers straight so all the movement is coming from the wrist. You can also put an object on your forearm, such as your phone, to make sure that you are not moving the forearm and only moving at the wrist. You can also reverse the directions, just as shown here. Next, we'll take a look at the side view, which will show a different compensation pattern. So here we are. The biggest compensation you'll see here is that right there. You'll start bending the fingers, which gives you a false sense of your wrist mobility and not an accurate representation. Now we'll go to the lower body and we'll start at the hip. Use a pull or something for balance, flex the hip up as far as we can, and then try to rotate out to the side. Once again, don't let the other hip move as you're trying to keep everything nice and tight. Start to rotate internally, making sure not to twist at the trunk so the motion's only coming from the hip. Bring it back so your knees come together. Extend back without arching your back. Externally rotate up, once again trying not to move at the trunk. Come back to the starting position. If we look from the side, once again we will flex the hip up, making sure not to bend the leg that we're standing on as shown. Start to rotate out, internally rotate, and kick back, but do not arch as shown there. You want to keep your back as stiff as the only motion that should be happening is at the hip. Next, we're going to be looking at the knee joint, which includes tibial rotation. If you put your finger right at the bone, also known as your tibial plateau, you should be able to feel slight movement. So dorsiflex all the way up, rotate to the side, and you should feel that bump move as you extend up. Do not fully extend the knee, as you cannot get tibial rotation if the knee is locked. So we'll rotate outwards, kick up, rotate inwards, and back down. You can also reverse this motion, but you should always feel a little bit of movement if you keep your hand on that bone. And once again, do not completely lock out the knee, as you will not be able to get adequate rotation from that point. Next, we're going to take a look at the ankle. For this motion, we don't want the tibia to rotate, so try to make sure the bone under your hand is not moving as we go through all the motions here. So we'll start by pointing down as far as we can, rotating inwards, fully coming up, and then back around. You can switch the directions as well, but once again, trying to limit the motion at the knee of that rotation and keeping it all at the ankle. The last part of the morning routine we recommend is working on your feet. You can start by just keeping the big toe down and lifting the opposite toes. I like to do about 5 reps of this, followed by 5 reps of just trying to bring the toe up as far as you can and trying to bring it up a little bit higher each rep. After that, we can bring all the toes up, and then we'll just practice putting the toe down while keeping all the rest of the toes up. This will be a little bit easier compared to our next one, which is splaying the toes out and then trying to piano key them one at a time all the way down. This takes the most control out of all of them we've gone through so far. Do this morning routine every day. It can take as little as 5 to 15 minutes, depending on how many reps and concentration you go through.